once we have the opportunity, once we get the two service lines under management, we have to kind of go through a process of identifying the leaders of the two services, the site medical directors, many of whom are visiting with us today at our leadership conference, and setting up a patient flow committee. And the patient flow committee is really designed to identify all the points from presentation to the emergency department as a patient, and the continuum of care from that point to being discharged from an inpatient stay. So you're a patient that comes to the ER. The ER disposition is that you need to be admitted to the floor. You're admitted to the floor. You stay in the hospital for however long, and then you're discharged from the hospital. What happens between presentation to the ED and discharge from the inpatient stay? And when you bring together all of the personnel, all of the various department heads in a hospital that affect that process, it becomes kind of an exercise in engineering, I guess, and productivity, if you will, on some level. Is you're trying to figure out, where in the process are there obstacles that slow things down, that produce maybe bad outcomes for the patient or negative impressions for the patient. Everything is viewed through the prism of patient satisfaction and quality care for the patient. So it starts with the leadership. It starts with forming the group to kind of begin to examine these processes. It's not a game of finger pointing or blaming. It's a process of discovery and creation of opportunities to make improvements. And so we've seen, you establish kind of a baseline for where the program is. What are the current metrics on throughput times, on time from when you as the ER physician makes the decision to admit the patient? How long does it take from that point to the patient getting into a bed on the floor? That can vary from hospital to hospital, and that can be a very important indicator of whether or not ER patients in the waiting room are leaving. In other words, if you're boarding a patient in the ER that you've already made the decision to admit, but the floor's not ready for them, Joe Blow in the waiting room leaves because he doesn't want to wait for that process to work itself out. So that was one in particular that's a big one.